What is ASD? Autism spectrum disorder, or ASD, is a neurological and developmental disorder that begins early in childhood and lasts throughout a person's life. It affects how a person acts and interacts with others, communicates, and learns. It includes what used to be known as Asperger syndrome, and pervasive developmental disorders. It is called a spectrum disorder, because people with ASD can have a range of symptoms. People with ASD might have problems talking with you, or they might not look you in the eye when you talk to them. They may also have restricted interests and repetitive behaviors. They may spend a lot of time putting things in order, or they may say the same sentence again and again. They may often seem to be in their own world. At well child checkups, the healthcare provider should check your child's development. If there are signs of ASD, your child will have a comprehensive evaluation. It may include a team of specialists, doing various tests and evaluations to make a diagnosis. What are the causes of ASD? The causes of ASD are not known. Research suggests that both genes and environment play important roles. There is currently no one standard treatment for ASD. There are many ways to increase your child's ability to grow and learn new skills. Starting them early can lead to better results. Treatments include behavior and communication therapies, skills training, and medicines to control symptoms. Treatment for autism spectrum disorder. Currently, no treatment has been shown to cure ASD, but several interventions have been developed and studied for use with young children. These interventions may reduce symptoms, improve cognitive ability and daily living skills, and maximize the ability of the child to function and participate in the community. The differences in how ASD affects each person means that people with ASD have unique strengths and challenges in social communication, behavior, and cognitive ability. Therefore, treatment plans are usually multidisciplinary, may involve parent-mediated interventions, and target the child's individual needs. Behavioral intervention strategies have focused on social communication skill development, particularly at young ages when the child would naturally be gaining these skills, and reduction of restricted interests and repetitive and challenging behaviors. For some children, occupational and speech therapy may be helpful, as could social skills training and medication in older children. The best treatment or intervention can vary depending on an individual's age, strengths, challenges, and differences. It is also important to remember that children with ASD can get sick or injured, just like children without ASD. Regular medical and dental exams should be part of a child's treatment plan. Often it is hard to tell if a child's behavior is related to the ASD, or is caused by a separate health condition. For instance, head banging could be a symptom of ASD, or it could be a sign the child is having headaches or earaches. In those cases, a thorough physical examination is needed. Monitoring healthy development means not only paying attention to symptoms related to ASD, but also to the child's physical and mental health. Not much is known about the best interventions for older children and adults with ASD. There has been some research on social skills groups for older children, but there is not enough evidence to show that these are effective. Additional research is needed to evaluate interventions designed to improve outcomes in adulthood. In addition, services are important to help individuals with ASD complete their education or job training, find employment, secure housing and transportation, take care of their health, improve daily functioning, and participate as fully as possible in their communities. Types of treatments. There are many types of treatments available. These include applied behavior analysis, social skills training, occupational therapy, physical therapy, sensory integration therapy, and the use of assistive technology. The types of treatments generally can be broken down into the following categories: behavior and communication approaches, dietary approaches, medication, complementary and alternative medicine. Dietary approaches. Some dietary treatments have been developed to address ASD symptoms. However, trials found little evidence to support the use of dietary treatments for children with ASD. Some biomedical interventions call for changes in diet. Such changes can include removing certain foods from a child's diet, and using vitamin or mineral supplements. Dietary treatments are based on the idea that food allergies or lack of vitamins and minerals cause symptoms of ASD. Some parents feel that dietary changes make a difference in how their child acts or feels. If you are thinking about changing your child's diet, talk to the doctor first or with a registered dietitian to be sure your child's diet includes the necessary vitamins and minerals for their growth and development. Medication. There are no medications that can cure ASD, or treat the core symptoms. However, there are medications that can help some people with ASD function better. For example, medication might help manage high energy levels, inability to focus, anxiety and depression, behavioral reactivity, self-injury, or seizures. Medications might not affect all children in the same way. It is important to work with a healthcare professional who has experience in treating children with ASD. Parents and healthcare professionals must closely monitor a child's progress and reactions, while he or she is taking a medication to be sure that any negative side effects of the treatment do not outweigh the benefits. Alternative medicine treatments. To relieve the symptoms of ASD, some parents and healthcare professionals use treatments that are outside of what is typically recommended by pediatricians. These treatments are known as complementary and alternative medicine (CAM) treatments. CAM treatments refer to products or services that are used in addition to, or instead of traditional medicine. They might include special diets, dietary supplements, external icon, chelation, a treatment to remove heavy metals such as lead from the body, biologicals, for example, secretin, or mind-body medicine. Many of these treatments have not been studied for effectiveness. Moreover, a review of studies on chelation found some evidence of harm, and no evidence to indicate it is effective in treating children with ASD. Current research shows that as many as 1/3 of parents of children with ASD may have tried CAM treatments, and up to 10% may be using a potentially dangerous treatment. Before starting such a treatment, talk to your child's doctor. Thanks for watching our video. Make sure you subscribe to receive more video related to ASD, ASD symptoms, ASD medication, and many other everyday health and fitness. Thank you so much for watching.